In 2021, President Yoweri Museveni directed that medical interns be paid a monthly allowance of 2.5 million shillings to help the doctors meet their basic needs. However, close to 3 years down the road, the intern doctors have continued to register their complaints following the lack of fulfillment of the order by the authorities in charge of allocating budgets, hence recurring strikes. Today, as the interns marked Day 7 in industrial action, leaders under the Federation for Uganda Medical Interns, FUMI, and Uganda Medical Association gathered to express their concerns, but this time in a peaceful manner.
For the record, we don't want strikes. We are in fact tired of strikes. But the condition, the status quo, is not allowing doctors and these young colleagues a breathing space.
The Secretary General for the Federation for Uganda Medical Interns, FUMI, however, condemned hospital authorities who have resorted to frightening the interns. He also said that they are taking the step to seek justice legally to protect the doctors.
We call upon all these medical directors, hospital directors, medical superintendents to desist from that vice, because we have the constitutional right and we are seeking for legal measures to counteract all this intimidation, desist from terminating the contracts of medical interns because they are serving for the cause.
He gave words of encouragement to the doctors, urging them to stay firm.
We are firm despite all intimidation that are going on. We are continuing. Our only prayer and request is all relevant authorities should get involved in getting the solution to the existing problems.
The Secretary Generals of FUMA and Uganda Medical Association, Dr. Mirembe Joel, both called on government to meet their end of the bargain, especially implementation of full payment of medical interns.
The government and its stakeholders, enough is enough. We don't want any more strikes. Let these issues be addressed once and for all.
Dr. Mirembe went on to pass new requests to Parliament, including pre-planning for intern doctors 5 years in advance in order to avoid similar situations of unpaid workers.
Allocate funds to this vote of medical interns and a probation appointment in public service, and allow not to pass the budget until when this is implemented. Two, we have a national planning authority and the respective ministries, Finance, Ministry of Health, have planning departments. We request them to work with Ministry of Education and track the admission progress of students such that we have a picture of how many doctors, nurses, pharmacists, midwives will graduate in at least a picture of 5 to 10 years. This will allow adequate appropriation of resources.
Responding to the Ministry of Health spokesperson's recent say on the matter of replacing the interns with pre-interns in case of continued strikes, the heads said this would be unfair.
Tuli wamu nabo tetugenda kikkiriza kubanga tekiri fair, twekubidde omulanga tuzzeeyo tubalaze obutali bumativu bwaffe, batuyite nga bwe baasuubiza nti bali ready okubeera nga batuwuliriza, twogere nabo tutuule ku round table tulabe engeri gye tugonjoola ensonga eno.
Ako kakodyo kakutujja ku mulamwa kututiisatiisa tuve ku kye tulwanirira, kubanga ne banaatujjawo ne baleeta bali ensonga ze zimu ze bajja osanga era nabo bajja kwekalakaasa.